Ever wondered what diabetes really is, but all the explanations sound super complicated? Let's break it down in a way that actually makes sense. First, what even is diabetes? Think of it as a long-term condition where your body has a tough time managing the sugar in your blood. Now, sugar, or glucose, is super important. It's the main fuel that gives your body energy. But, like with most things, too much of a good thing can be bad. If you have too much sugar in your blood for a long time, it can lead to serious health issues. So, how is your body supposed to handle sugar? Normally, when you eat, your food gets broken down into sugar, which then enters your bloodstream. This signals an organ called the pancreas to release a hormone called insulin. Insulin is like a key. It unlocks your body's cells, letting the sugar go from your blood into the cells to be used for energy. With diabetes, this key either doesn't work right or you don't have enough of them. There are three main types. First, there's type 1 diabetes. This is when the body stops making insulin altogether. It usually starts when you're a child or a young adult, and it has nothing to do with lifestyle. People with type 1 need to take insulin every single day to live. Then there's type 2, which is the most common kind. Here, the body either doesn't use insulin well, or it just can't make enough to keep up. It often shows up in adults, but we're seeing it more in younger people too. It's often linked to things like being overweight, not getting enough exercise, and family history. Management usually starts with lifestyle changes, maybe some pills, and sometimes insulin is needed later on. The third type is gestational diabetes. This happens to some women during pregnancy and typically goes away after the baby is born. However, it does increase the risk for both the mum and the child of developing diabetes later in life. So, what are the signs? You might notice you're peeing a lot, you're always thirsty or hungry, or you're losing weight without trying, especially with type 1. Other signs include feeling tired all the time, blurry vision, cuts that heal slowly, or getting infections frequently. It's tricky though because some people with type 2 diabetes might not have any symptoms at first. Why do doctors take it so seriously? Because if your blood sugar stays high for too long, it can damage important parts of your body. We're talking about your heart, which can lead to heart attacks or strokes. Your eyes, which can cause vision loss. Your nerves, leading to numbness or pain. Your feet, which can have poor healing and infections. And even your kidneys, potentially leading to kidney failure. The good news is that keeping your blood sugar under control dramatically reduces these risks. So, how do you manage it? While there's no cure for diabetes, it can be controlled really well. The main pillars of management are healthy eating, regular physical activity, taking medication like pills or insulin if prescribed, and monitoring your blood sugar levels. And of course, regular checkups with your doctor are crucial. People with diabetes can absolutely live long, full, and active lives when they manage it properly. What about prevention? Type 1 diabetes can't be prevented. But for type 2, the story is different. It can often be prevented or at least delayed by sticking to a healthy diet, getting regular exercise, and maintaining a healthy weight. Let's quickly bust a few myths. First, eating sugar alone does not cause diabetes. Second, people with diabetes don't have to avoid all sugar completely. It's all about balance. And third, diabetes is not contagious. You can't catch it from someone. So, the big takeaway is this. Diabetes is all about how your body processes sugar. With the right care, education, and lifestyle choices, anyone with diabetes can live a long and healthy life. If you found this helpful, give this video a like and subscribe for more simple health guides. Thanks for watching.